enter right in the area. You're going to aspirate, checking to see if there's any blood in there, and you see no blood, then you're going to inject and out. You want to get a gauze and wipe it and rub it a little bit.
Are you ready? 1, 2, 3, straight in. Because it's a vaccine, I do not need to pull back on the plunger. I'll give the vaccine, put the safety needle on, and she's done.
You want to put some tension on the fascia so that it doesn't move anywhere. And in a quick fluid motion, go straight into the muscle. Stabilize the needle with the other hand. Aspirate to make sure you're not in any vein or vessel. And when you've done that, you can just simply inject and remove.
I'm going to hold my hand here and then go straight in with the needle. If you inject the medication slowly, then the patient's not going to feel it as much, so it's less painful for the injection. If you push it in really fast, then you're going to feel a little bit more.
Okay, pinch, get nice and close, bevels up, go straight in, don't hesitate. Coming around, aspirating, making sure no blood, inject. And you want to make sure too that you're not dimpling that skin. Don't push it in. Come straight out.
Insert the needle at a 90-degree angle all the way to the hub of the needle. Maintain contact with the patient at all times. While supporting the patient and the syringe, depress the plunger in a smooth and coordinated manner. Immediately activate the safety device.
You want to stay at a 90-degree angle and make sure to aspirate. You take your non-sterile gauze and withdraw the needle.
Slowly let your breath out.
Oh, it's not too bad. I feel it now. Actually hurting.
Okay. Take another deep breath and hold your breath. Slowly let your breath out.
Hold the syringe between thumb and index finger of the dominant hand. Using a quick motion, fully insert the needle at a 90-degree angle to the arm. Stabilize the syringe with the non-dominant hand while using thumb or index finger of your dominant hand to depress the plunger slowly to inject the drug. It is not necessary to aspirate in the deltoid, but some clinicians prefer it. Remove the needle smoothly along line of insertion.
Okay, and once you go in, you just insert at that angle. You're going to aspirate. Whenever you aspirate, you're going to take the plunger and you're going to pull back just a little bit. Make sure you don't have any blood. You're not in a vessel. And here we're not, of course. And then you're going to inject the medicine just straight through like that. Hold in there for about 10 seconds so the medicine can get good inside the muscle. And then you are going to pull straight out. Engage your safety.
All right, here I go. All right, so I have my needle in, and with correct order of draw, the light blue tube will go first. We'll let it fill. And this is one of the hard parts, is holding steady with the tube as you're drawing. You still want to have a good hold on the needle. Okay. And remember, always with light blue, you need to let it fill completely. It's pre-vacuumized to stop at a certain amount. All right, so it's full. We'll go ahead and disengage this tube. Insert the next. And sometimes a little blood will come out around the edges. That's okay too. And one thing that you can look for to help you tell when the blood is done is it shimmers as it's moving, as it moves in. Once it stops shimmering, more likely your tube's full. And this tube is full. It's my last tube, so I'll release my tourniquet. Pull the tube out. Get my gauze, fold it over once, twice, pull my needle out, cover.
Stretch the skin taut at the injection site by pulling gently with the thumb and forefinger of your non-dominant hand. Hold the needle very close to the patient's skin. Insert it slowly at a 5 to 15 degree angle until you feel resistance. Advance the needle through the epidermis to a depth of about 1/8 of an inch or 3 millimeters.
I like to insert it more on the mesial, towards the mesial of that canine to aim for that foramen that's right there. You'll insert. And then you'll aspirate and deposit your solution. This one takes about 1/4 of a carp.
I'm going to insert the needle at a 10-degree angle. I'm going to slowly push in, administer the medication, and it's going to become a wheel.
When she's administered her full amount of medication, she'll slowly take the needle out.
Yeah, 10-degree angle, just under the first layer. There you go, and keep it right there. Come around with your left hand, and don't move this hand around. Hold it nice and tight, and then push it in.
Area of insertion is height of mucobuccal fold above maxillary second molar. The orientation of bevel is towards the bone. Now you ask the patient to partially open the mouth, pulling the mandible to the side of injection. Retract the patient's labial mucosa and pull the tissue at the injection site. Insert the needle into the height of mucobuccal fold over the second molar and advance the needle slowly in upward, inward and backward direction. Aspirate in two planes. Rotate the needle bevel and then re-aspirate. If both are negative, then slowly deposit 0.8 to 1.8 ml of local anesthetic solution.
Thanks, there you go. Don't let it go, don't let it go. Oh, hold on to it, hold on, hold on, hold on. There you go. Okay, and inject.
Then we aspirate, and if it is negative, we deposit approximately 0.6 ml or 1/3 of the cartridge slowly for over 20 seconds. We do it slowly so then the tissue won't be causing any balloon. And then we slowly withdraw the syringe and make the needle safe.
is inserted into the height of the buccal fold adjacent to the maxillary first premolar. The needle is held parallel to the maxillary bone and inserted until bone is contacted at the roof of the infraorbital foramen. After 2 negative aspirations, 1/2 to 2/3 of a cartridge of local anesthetic is deposited over 30 to 40 seconds.
This one could pinch just a little bit more in the front.
This helps anchor the vein that you're going into. As you go into the vein, you will feel it kind of give, and that is your cue to get the blood bottles ready. Start taking your blood. Now, we've accidentally put on the other side. If you're right-handed, put it on your right side. Make it easier for yourself. Make life easy. And take your blood. Anchor the needle with your non-dominant hand and don't move. Try to keep it as stable as possible. Once you've taken your blood, before retracting the needle, important to take the tourniquet off.
Anchor your patient's vein. On the count of 3, 1, 2, 3. Have the blood flash. Be sure to watch for your fill line.
I will be going in a minute. Okay, if you'd like to just relax your arm for me. Just taking the tourniquet off.
With a single, short but firm motion, swiftly insert the needle through the skin and into the vein. Push the evacuated tube onto the needle when the needle enters the vein. As the vein aligns with the needle,
anchor your vein, and 1, 2, stick. You want to slowly pull back. With this test that I'll be performing, it's a serum test, I'll need 3 milliliters of blood. So very slowly I'll pull back the plunger until I have 3 milliliters of blood. I can tell when I have 3 milliliters of blood because my syringe is a graduate cylinder, which means it's been marked on the side. You'll see the blood slowly move in, gradually pull back your plunger. This will take a little bit of time because obviously if we're doing this, our patient cannot tolerate the suction from regular tubes. It's also important to go very slow because if we pull our plunger back, we can hemolyze our specimen by pulling back the plunger too fast. Okay. And as we're doing this, keep in mind your patient may be nervous. It's okay to talk to your patient. Probably would put them at ease too. This could take a couple of minutes to draw the amount of blood you need. Okay. Looks like I almost have my 3 milliliters of blood. So what I'm going to do is I'm going to release my tourniquet, grab my gauze, fold it over once, fold it over twice, pull my needle out,